If you have cesarean scar pain while pregnant, it's best to get that assessed in person by a perinatal therapist. Every pregnancy is different. Sometimes we think it's scar pain and it's something else. It's really good to get a confirmation as to the source of the discomfort. And cupping in general, I have never cupped anybody when they were pregnant as a practitioner. Doesn't mean that some people don't, but in general, it's a very, very painful technique, especially if you were in the third trimester. There's not much to suction. It can be quite painful in the fascia. In a word, yes, I talked a lot about why this is the case in my Instagram live today, and that is linked to my grid. So take a look at that. It's probably the first 10-15 minutes I talk extensively about how vertical incisions differ from horizontal incisions and how the massage is going to be a lot more important and a lot more impactful. It's going to be tougher to mobilize as well if you leave it for a little bit longer in comparison to a horizontal incision. As I mentioned in my Instagram live today, I don't make full videos about how to do scar massages of any kind because safety is the most important thing. I mean, you can massage your body, but you can hurt yourself too if you're not quite sure what you're doing. So the best thing to start with is to take a look at this resource below. It talks about safety first and the 3 principles of massage that you really want to keep in mind when you are being your own therapist. Okay, take a look. At 2 weeks postpartum, if there are ever any major questions, please ask your doctor. You just want to make sure that everything is healing correctly, that there are no infections. And the sooner they catch it, if there is a problem, the sooner you can actually correct it and heal. And assuming everything is going as it should, a hard area under the skin is not uncommon. It could be dissolvable stitches, it could be harder scar tissue, but again, best to get that checked out by your physician. It's possible, but it's important for me to know what type of lower pelvic discomfort you are feeling. Are you talking about the actual pelvic floor? Are you talking about discomfort during sex? Are you talking about discomfort when moving and exercising? Are you talking about incontinence during activity or even at rest? Urge incontinence is different than stress incontinence. So honestly, I would see a pelvic health therapist if you are concerned, or one-on-one assessment with any perinatal therapist. My ABCs program is the first step to core retraining, diastasis recovery. So the best time to actually start it is while you're pregnant. So to the mom who asked this, she's got a few weeks before her scheduled cesarean is happening on February the 9th. And of course, the second best time to start your ABCs is after you give birth. And it's never too late. So if you're like, wow, I've never done any core retraining, or like I have, and it's not working, I'm not quite sure what's missing, the ABCs program takes it right down to the 3 foundational pieces. A is for alignment, B is for breathing, C is for core control. Literally, those are the things that if you will have a really great recovery, even if you didn't do much of anything else. So I'll link that information down here below. Dissolvable staples should be dissolved by 14 weeks postpartum. It might be a good idea to get this checked out by your primary care provider. Just get that sorted out first. I'm not sure that I would disturb that area while it is still healing when there is something external there. A purple or darker colored scar at 14 weeks postpartum is actually very common. It's common because it's still early in its healing. And I know you don't feel like it's early in its healing. I mean, it's already been 3 months, for goodness sakes, right? So I get that. Here's the thing. If it didn't really start out purple, but now it's getting darker, you want to double check what kind of